Dr. Jaksic, please go ahead.
Well, thank you very much. And the analysis that both of you witnesses has given us has been very, very insightful, I think, for all of us who've been following, obviously, this pandemic now for a number of months. And I assure you, I'll give you plenty of time to answer my questions. I was in public health practice as a local medical officer of health for nearly 2 decades. And certainly the communication of risk and people's perception of risk does vary tremendously. And it's very difficult to actually communicate that. Professor Gostin, you started by talking about trusting the experts, making sure that people understand that a lot is unknown and that you are trying to communicate honestly and so on. At this point in time, going forward, what do you see as the role of the WHO in communicating risk, in making sure that people voluntarily adopt physical distancing and the public health measures that are recommended? Can you give us what you would see an ideal way forward?
Yeah, I mean, WHO is in a more difficult position in terms of risk communication and health advice than a national government would be, because their advice goes to every country. And so you might, I think Jeremy was right. The mask issue was because of evolving science. Some of it, we just didn't really realize that it was such a risk mitigation measure. And particularly because there was asymptomatic transmission going on. But on the other hand, there are some countries where mask use is not as easy and effective as it would be in other countries. And so WHO is in a difficult position. But my advice to WHO, and I'll state it publicly, that they know it, is exactly what I'd said before. To actually state honestly what we know, what we don't know, express that uncertainty. Anybody who tells you that we're sure of something in this COVID-19 pandemic, you need to take with a grain of salt. I've said to myself, Larry, I can't get my health set on the head. We have to approach this virus with some humility. That doesn't mean we ignore science. We have to double down on science to try to find out the answers to this. But we do have to have humility, and we don't want to be preachy. We want to explain what levels of uncertainty are, understanding that people do have different risk tolerations and different risk perceptions. They absolutely do. All the science tells us that.
Mr. Konyndyk, would you have anything to add?
Yeah, I agree with Larry. I mean, I think, partly what we're seeing here is this is the process of science playing out. We start with a lot of uncertainty. We make a best guess based on the closest parallels that we have. And there's a real challenge in public health communication between providing that information in a way that is authoritative without being overconfident or without being misleading. And I think that is not, I don't think, frankly, much of the world has done a good enough job of communicating that uncertainty. And as we understand more about the science of the disease, the recommendations evolve and change. And I think that's what you're seeing. So that, we are finding that to control COVID, we need to do different things than we needed to do to control SARS, because the SARS did not have the kind of asymptomatic transmission that we're seeing here, and different than what we needed to do to control flu. But at the beginning, we had no way of knowing that. So, recommendations were based on the closest known parallels that we had. As we gather more data and more information, those recommendations have evolved. And I think that is a difficult thing. If you're a member of the public only paying kind of partial attention to this, and you see those changing recommendations without really understanding the rationale behind them, it is confusing. It does undermine trust.
In Canada, we have another complication in that, of course, we have a very vast country, different geography, different demographics. And one of the issues where I think perhaps public trust was somewhat eroded was that there was a lack of consistency in public health guidelines in terms of allowable behaviors, even now as we're opening up the economy. And so there has been some suggestion that we would be best served with some national standards, at least. And in a way, you alluded to, I think, Mr. Konyndyk, a little bit to gradations within public health emergency standards, so that it's fairly clear that different jurisdictions might have different responses depending on where they are within the emergency gradation, so to speak. What do you have some comment, Mr. Konyndyk, on how a vast country like Canada might ensure some more consistency?
Absolutely, and we are struggling with the exact same problem here. I think one of the challenges that one of the challenges with this is it hits different places at different times due to reasons we don't yet fully understand. And so it's kind of easy for the areas that, in the United States that locked down earlier, so locked down before they had a raging crisis, to then, to look at that and rather than thinking they dodged a bullet, to think they were bulletproof. And I think some of the states that now reopened, in my view, too early and too recklessly, are paying a real penalty for that. Arizona is about to have its hospitals overwhelmed, as are parts of Texas, and I think Florida is not far behind. And the reason for that was they assumed that there was some difference inherent in their states that meant they were not going to face the same sort of situation that New York faced eventually, or that this problem was unique to New York. And I think there are absolutely differences, there are gradations, but the fundamental thing we know is that if you give this virus oxygen, it will burn you down. And if you do not have some way of controlling it, and you can't sustain a lockdown forever, and you shouldn't need to. And I think what we see from South Korea and Hong Kong and Taiwan and some of the better performers in East Asia is if you have good testing, tracing, strong public health measures, and you're following the science, you don't need these long-term, very crushing lockdowns. But you have to pass the baton to something if you're not going to keep the social distancing measures in place. And if you lift social distancing without having the other measures in place, as much of the US is doing, that's disastrous.
I might just add two dimensions to this as well, because Canada and the United States, other countries like Russia, are federalist countries. And so how do you deal with a pandemic in a country that divides its powers and its influence among various jurisdictions? Often federalism has strengths because you can have local innovation, local experimentation, but you also need a consistent, as you said, a consistent national guidance and consistent national response, because if there's a fire in one place, it will spread to other places. And so you do need that federal leadership. The other thing we're seeing in Canada and the United States and Brazil, many other places, is a political and cultural divide. A virus should be make us all think, well, it doesn't matter, what political party we are, what ideology, whether we're rural or urban, what our culture is. We need to, respect that virus the same way. But somehow this has become a political, cultural symbol. That's very unhelpful when we start to do that.
Thank you, Dr. Jaczek.
Thank you.